different areas. And I'll just say straight off the bat, me, Casey, and we're not affiliated with pharma companies or any types of corporate interests. Our organization isn't affiliated in any way. We're not funded in any way with corporate interests. So,
That's good.
so this is me and my colleague, Casey. I'll just give a short introduction. I normally live in Washington, D.C., but I'm here in San Diego, California with my parents right now. So that's where I'm calling you from. I'm a child of immigrants. Both my parents came from India. My dad came actually 50 years ago, my mom about 45 years ago. And as a fun random fact, one of the things I've been doing during the pandemic is learning how to knit. So I've been knit and purl stitches from my mom, and we're making a really nice scarf for me for the winter. And I'll toss it over to my colleague, Casey, to introduce herself.
Hi, I'm Casey. Like Anita said, I also work at the Union of Concerned Scientists. I was originally from Illinois, and I went to school in Wisconsin, so I'm also a Midwesterner. I've only been in DC for the last couple years, and that's where I'm calling from right now. And I guess a fun fact about me, I'm just gonna piggyback off what Anita said, is I actually learned to crochet when I was about 7 years old. My grandmother taught me because I was very curious about what she was doing over on the couch with all this string. And I like to brag that I think I can crochet anything.
Very good.
So yeah, so that's a little bit about us, and we'll be happy to talk more about our backgrounds or Union of Concerned Scientists in the FAQ, or sorry, in the questions at the end. So in terms of a first question, I think one question you all might have or you might receive is, how do I place my trust in this type of vaccine? And it's understandable to have this type of mistrust. The US has a sadly long history of medical racism against communities of color, people of color. And to give kind of two examples of that are the Tuskegee syphilis study. This was a 40-year study.
In the back. I thought this was a training.
I think I'm getting interference. So if anyone hasn't already, if you could mute your own microphone, that'd be great. But yes, the Tuskegee syphilis study, it was a pretty egregious event for a number of African-American folks from a rural background in Alabama had syphilis or put into the study and were for literally decades denied effective treatments. And some of the individuals died and their family members were hurt as a result. So that's just one of the worst events in modern U.S. history. Another example involves Henrietta Lacks. She was an individual that came from Baltimore, Maryland. She had a certain type of very aggressive cancer, and when she went to her doctors at Johns Hopkins, they removed cancer cells without her knowledge and gave it to certain medical community that later on used her cells to carry out another number of medical discoveries that basically never benefited Henrietta Lacks or her family. She's African American, coming from humble backgrounds, and that's another example of where it was an egregious atrocity for a vulnerable individual. So there's a number of events like this, but what we want to take away is that there have been reforms that the government has been trying to carry out as a result. So one of them is the Office of Human Resource Protection. It's a group, it's a literal government office associated with the Department of Health and Human Services. Their whole job is to kind of make sure that ethics are involved in every single scientific study. So if you are in any university or whatnot, you are required to go through what's called an internal review board and get approval from scientists and community members to make sure your human subjects are protected. And for vaccine trials, the standard tends to be much higher, or even higher, I should say. So I'll flip to the next slide, and Casey will be presenting on this.
Yes, so just to make sure we are all kind of on the same page, we wanted to give you a little information about how vaccines work. So basically, a vaccine is a way for us to harness your body's natural immune system and defense mechanisms by introducing the body to an unharmful part of a virus or a unharmful version of the virus. And basically, this makes it, oh, sorry, Anita, could you advance the slide?
Oh, sorry about that.
Thank you. And basically this makes it so that your body can kind of introduce itself to the virus, be able to become familiar, recognize the virus when it encounters it. And then the next time you come into contact with the virus, your body will have already built the defense mechanisms that it needs to fight it off. And if you're interested in learning a bit more, I have included a link to a video as well as a New York Times page that goes into more detail about how vaccines work.
All right, Anita, I'll describe what scientific evidence do we have that the COVID-19 vaccines work well. And I'll be focusing on two vaccines that were recently approved. One was the Pfizer vaccine, and another was the Moderna vaccine. So all the information I'm going to present, this is coming from scientists at the Food and Drug Administration. So these are government scientists who reviewed the data with a fine-tooth comb. And this is what they're saying. That they said that tens of thousands of people were tested in these clinical trials, and both of the pharma companies published methods and protocols, and both of the vaccines showed evidence of effectiveness. So you can see here that there's oh yes, I'm seeing some from the chat. Yes, we will be sending out this information on a fact sheet and other things. But so sorry, so these are some information on the two vaccines. They're pretty similar in terms of how effective they are. In 95% of people, they work. They prevent major COVID symptoms. And another major question is, are they safe? So both of these two vaccines have shown to be safe. Just to give you a primer, when health experts try to figure out if vaccines are safe, they look for reactions within 6 weeks. That's the vast majority, practically all of them occur within that window. So researchers instead asked followed participants for 8 weeks to check for side effects. And these side effects are kind of things you might expect. So fatigue or headaches, things that you might get after getting a flu vaccine, kind of may put you out for, maybe a few hours or a day or two, but nothing too bad. I'll also mention that Moderna is currently trying to test if its vaccine is safe in children from 12 to 17. Mostly I'll be talking here about adults. So are the vaccines safe and effective for people like me? So one thing that was stressed was during the clinical trials was that age groups, genders, and racial and ethnic groups need to be tested across the board to make sure that it's actually working in a variety of different types of people. And so here's a breakdown in terms of race and ethnicity. You can see about 4 to 5% of people who are Asian American were part of the study, about 10% who are African American, 20 to 26% Latino, just under 1% for Native or Indigenous people, and for both studies is about 80% white. So again, these are representing thousands of people, hundreds or thousands of people in these studies. And a couple of other demographic information. It was tested equally in men and women, about half for both vaccines. A good number of people over 65 were tested, about 21% and 25%. And people with underlying health conditions. So this can be everything from like asthma or diabetes or obesity, couple of things that have been associated with severe COVID symptoms. And you can see that they were well represented also in the studies. Are there other vaccines being tested? And the answer is yes, quite a few actually. So here's a graphic from the New York Times. And here's some of the leading vaccine candidates that are kind of in these later stages. So I'll just mention that 20 of them are in phase 3 trials. These are the big trials, like with tens of thousands of people. So if they kind of get past that, that's when scientists go, you know, we might want to like actually start distributing it out to the public. So you may have heard of certain variants of COVID-19 that are coming about. One is coming from the United Kingdom, another is coming from South Africa. The main thing, both of these two variants, they don't increase, they're not as fatal as the original version, but they are more contagious. So they're more likely, if you're in the same room as someone who has a variant, you're more likely to catch it than the original version of COVID. So in terms of the vaccine, most in the scientific community feel that it's unlikely that variations in the virus will change how effective the vaccine works. And there's more research that's needed to kind of confirm these results. There's been some preliminary research showing that like it can be effective against a variant, but it's really preliminary. So it's a little bit unknown, but chances are it's good that the vaccine will work pretty well against these variants. Do you pay for a vaccine, or do I have to pay for a vaccine? So the answer is no. The US government is providing the dose at no cost, but one thing to note is there can be an administrative fee associated with it. This will be covered by your insurance, or for people who are not insured, there's currently a relief fund being set up by the government. We have the link here if you need more information, but you should be able to go to a vaccine and get it without charge. So